Our first honoree, a native of Eureka, Kansas, Dr. Ball graduated in 2010 with a degree in biology from the College of Arts and Sciences. She is a medical doctor and pediatrician at the Golden Valley Memorial Hospital in Clinton, Missouri. Without further ado, please join me in welcoming Dr. Jamie Ball.
All right, everyone. Hello, my name is Jamie Ball, and I want to first start out with telling a big, huge thank you to the K-State Alumni Association, Student Alumni Board for this incredibly humbling honor. The Alumni Association and Student Alumni Board played a huge, huge part in my K-State experience and in who I am today. So to receive this from you all is truly humbling. And I look back at the list of past honorees who most of them I know personally, and I feel like I don't know what you guys were thinking, because I do not fit in with that class of individuals who I looked up to during my whole K-State experience. But today I'm going to try to give you a little outline of where I came from, where my K-State experience was at, and how I've gotten to where I am today. So I want to give you a little roadmap of how I ended up at K-State. So we'll start with where it all began, what my K-State was like and what it means to me, the journey that I have taken, which you'll come to find has not been traditional in any sense, and how K-State transitioned to my career today, and then finally, test points. So where it all started. I was born and raised in Southeast Kansas in good old Eureka, where there's more cattle than people. I grew up, I have one younger sister, Kelsey, who I was blessed enough and was lucky enough to share my K-State experience with my younger sister, Kelsey, who also graduated from K-State with a Bachelor of Science from Human Ecology in 2011. She's now a nurse at the other hospital, KU Med in Kansas City. But we grew up from the start in a house divided. So you can see that's my mom and my dad, and I actually believe he's wearing a KU hat in that picture. But we grew up in a house divided. So I can remember when we were little, if we weren't at the ball games, if we were in the room with mom, who's a K-State grad, you were cheering for K-State. If you were in the room with dad, you were cheering for KU, and you were made sure that the other one didn't hear you. But my poor dad never stood a chance. We were K-State purple through and through. I attended local schools there in Eureka. We were a 3A high school, and there were 56 in my graduating class. These are some pictures. My grandfather, both of my aunts who are K-State grads, my sister in all of these. Now, what brought me to K-State? So I told you I had K-State house divided, but I had several key family members who were alumni. So my mom was a K-State grad, as well as both of her sisters, both my aunts, and then an uncle. So we kind of grew up in Manhattan. I can remember from being little bitty going to football games, going to basketball games, hanging out in Aggieville, where they used to have the Palace, going to Barney's, all of those things. We just kind of grew up in Manhattan. It was like a second home to us. Then, you get a little bit older and you start thinking about school, and you kind of go through that where, do I want to do the same thing that my family did? But what drew me to K-State was that small town atmosphere, but you had all of the major opportunities of a big university. You didn't sacrifice that family feel, and that was huge to me. You had all of the academic opportunities. So I kind of knew from the beginning that I wanted to do medicine. And there was a lot of pull at the beginning of, well, why are you going to go to K-State? Why there when KU is the one that has the medical school? But the degrees that were offered and the opportunities that I had in the classroom were what set me above and allowed me to be where I am today. And then K-State made it a very personal feel. From when I started in the recruitment process, everyone knew who you were. They wanted to know you as a person, not just you as a number. And here's some of my past growing up in Manhattan. me and my sister from the beginning, who was my partner in crime. So my story, I did not take necessarily the traditional route to be where I am today. Started all out in Eureka, Kansas, and brought me to K-State. At K-State, I got my undergraduate degree in biology and a secondary major of gerontology. And you're probably thinking, why does a pediatrician have a major in gerontology? That's kind of opposite ends of the spectrum. My journey didn't originally start out in pediatrics. So from K-State, I went to the other school, although I never set foot on that campus. All the med schools are in other places, just to point that out. And graduated there, Alpha Omega Alpha, with my medical degree. Now, from there, I transitioned to residency. In the beginning, I was a general surgeon. So that is how I started at KU School of Medicine in Wichita until this happened. Now, those of you who aren't in the medical field won't necessarily know what this means to you. And this was actually done in the middle of the night in the trauma bay. We ultrasound my neck because I had a mass that I had known about all through medical school that had come up and was getting bigger and bigger. And me and my fellow residents in between trauma patients sonoed it and then looked at the size of it, what was going on, cystic and solid, and realized that I had to do something. That's when I got the diagnosis that I had a very weird thyroid issue going on and had cancer issues going. So I went through the process of having a total thyroidectomy. And then this happened. I had complications from my surgery, and what originally thought would be a short 1 week recoup after having the thyroid out turned into a traumatic brain injury. I had a seizure and was in a coma for over 3 weeks. They didn't think I'd ever wake up from that one, but I was the stubborn person that I've always been. I don't know if I got that from my mom or my dad, you'll have to ask them. And decided that I was going to rehab this. So I went into TBI rehab for a year and then went back through the match for round 2. I went all the way out to Pennsylvania. I didn't want anybody to know my story. I didn't want to be viewed as the sick kid. I didn't want to be the one who was viewed as being weaker than anyone else. And so I went to a completely different surgery program after rehabbing it and started at a different program in Pennsylvania at Robert Packard Hospital. So started surgery residency round 2, and this happens. I was in the trauma bay evaluating an intoxicated patient, and he jumped off the table and decked me in the head. TBI number 2. So I had to go into TBI rehab again. I did another year of rehab, resigned that residency position so that I could rehab that. And then doctors and family had a long discussion with me about if I could rehab it and get back into medicine, would I be happy doing something other than surgery because of the risk of being in the trauma bay? And if, Jamie, if you have another head injury, you're not going to come out of it. So I decided all along, my end goal was never to be a general surgeon. It was to be a pediatric surgeon. And I knew that medicine was what I wanted to do. So I chose to transition to pediatrics. And that led me to going through the match for the 3rd time. And I ended up at University of Missouri at the Women's and Children's Hospital there for pediatric residency. So I did 3 years of residency at Mizzou, and then came to Golden Valley Memorial Hospital in Clinton, Missouri, where I'm a general pediatrician. So I kind of took a roundabout way to get to where I am, but I still get to practice medicine. So how did K-State make that all happen for me? It was an elite education. I was one of the few undergrad programs where we got to work on cadavers as an undergrad, which prepared me going into medical school to be miles ahead of my classmates because I had already done all those dissections. I did more dissections as an undergrad than I did in medical school. So I was more than ready. I had experience in research. I got to be involved in cancer research as a second semester freshman. So I got that hands-on experience, publication to add to my hat. I had hands-on learning, cadaver lab, the organic chemistry labs. I had multiple opportunities to jump into medicine from the get-go. Leadership skills. My mom will joke with me about this now that she told me when I first went off to college not to sit in my dorm room and get depressed. Little did she know that I would jump in head first and kind of go over the top. But K-State had so many organizations and things that we hadn't had in my hometown. And I was able to jump in and learn those skills that have allowed me to practice today, those people skills, those leadership skills through the different organizations that K-State offers. It allowed me to learn the meaning of philanthropy and giving back, being involved in Up Till Dawn and K-State Proud, things that you can give back to the people who helped you to get there and help other people have the same opportunities as you. And K-State taught me that value. It provided me with a network of not just mentors and role models, but of friends who have turned into my colleagues now, who I still talk to. It's a network that goes beyond just your educational goal and beyond your career goal. And then I had the mentors and role models, which I have been very blessed to have so many role models in all different aspects since I've kind of jumped around from thing to thing, but to have those people around me. So, I mean, you guys are still in the K-State experience. You got to have your testing points, right? That's the whole point of any lecture is, what are you going to take from this? What is the important thing? So my advice to current and future K-Staters, find your passion. Medicine was my passion. I thought that surgery was the end all be all, and that's where I originally started. But your passion can extend beyond what you originally thought it was. And for me, it was always about the kids. So you find what makes you tick, what makes you get up in the morning, what makes all of the hard work, the late night studying for tests, the going the extra mile to create that resume, that CV. What is it that is you? Surround yourself with people who make you better. And I don't think I realized this fully until I was at K-State. But I was in an environment where I was around the best of the best all the time. Student Alumni Board is a prime example of that. You have the best of the best at K-State. And being around those people, if you take the time to get to know each and every individual, to see their skill set, it makes you a better person. Be around the people who make you better, who make you want to be better, who make you realize that you can do anything with the right mindset. This is a picture of Dr. Larry Williams. He was my biology advisor and one of my professors who came to my medical school graduation. And that just shows you what K-State can do for you. He drove from Manhattan to Kansas City for my graduation, and he has remained a huge part of my life ever since. Sends me Christmas cards. He has guided me along that way from being the scared junior in high school, coming up to K-State where there's more people in my lecture hall than were in my class in my hometown, and kind of transitioned me to the real world. Everyone knows this lady, Amy Button-Rins, who has been a second mom to me since I was little. Amy, I think, was a huge draw in getting me to come to K-State from talking with me at an alumni picnic when I was a junior in high school and telling me when I got to K-State, you need to join Student Alumni Board. And that was the springboard for everything that has come since. Amy has been there for me through all of my hardships and trials and tribulations and has remained to be a huge part to me and my sister. This is Dr. Mary Lee McBoyle. She is a surgeon. in the Wichita area and was a huge role model and mentor for me when I was a medical student, as well as being in surgery residency. And she is one who has been at my helm from the beginning and fought for me to keep going after the TBIs, and is an amazing woman. She is someone who is so humble and has so much. She was the first trauma surgeon in the state of Kansas, and yet takes the time to teach medical students, to make them better. And she continues to be there for me each and every day. And then this man is Chris Fleming. He was my brain guru and got me through 2 years of TBI rehab. This man gave me my life back and has been a huge part of my life ever since. I mean, he didn't just have to put up with me once, he had to put up with me twice. So he's an amazing, amazing guy. He is a firefighter, an athletic trainer, and a TBI specialist. Be you. So there is no traditional role to get to where you are. I am a prime example of that. They will tell you that there is this straightforward of how to get into medical school, that you have to be a science major, you have to do research, you have to take this certain step. You don't have to. Be you. Find out what you love and make that work for you. It doesn't have to be what everyone else tells you to. Don't be afraid to be the nerd. Have fun. Be you. Who cares at the end of the day what everyone thinks? As long as you can say that you made a difference in one person's life, I think that's all that matters. Be you. There's me at a women's basketball game screaming my head off. Don't be afraid of what people around you think. Do what makes you feel better. These were some things that I wanted to leave you guys with. Feeling unsure and lost is part of your path. Don't avoid it. See what those feelings are showing you. Use it. Take a breath. You'll be okay, even if you don't feel okay all the time. I had to learn this time and time again. Through residency, you will feel like an imposter. Through medical school, half the time in undergrad, you see everyone around you and you don't feel like you belong. Take a deep breath. It's okay. You're where you're supposed to be. When you're comfortable, you're complacent. The moment that you feel comfortable, that's when things happen. That's when bad things happen, when people get comfortable. It's okay to have those feelings. It doesn't mean you're inadequate. Never be embarrassed to struggle. There's absolutely no shame in working hard to get to where you want to be. It's okay to fall. It's okay to falter. It's okay to have weakness. But acknowledge those. When people tell you that there's a weakness, that's an opportunity to make yourself better. Don't be embarrassed to struggle. Nobody's perfect. Embrace change. This is something that I had to learn. I started out here. I wanted to be the pediatric surgeon. That was my end all be all. That was where I wanted to be. I wanted to slice and dice. I love to work with my hands. That was my goal. That was the end. And then we ended up here. This was doing some of the TBI rehab, just trying to get to where I could see right again, learning to walk again, learning to talk again, learning what everyday objects are called again. It was starting over. I was kind of like that baby starting over. And then I ended up here as a pediatrician working with kids every single day. You have to embrace change. Nothing's ever going to be textbook. It's never going to go as you plan. That's life, but that's the beauty of it. You take what you're dealt and you run with it. Never let a stumble in the road be the end of your journey. It would have been really easy for me to say after that first TBI, going through rehab, to be like, I'm done. I'm done. This is it. I can't do it. Don't let that be the end. There's always another door. There's always another opportunity. It may be a doggy door or a window that you got to crawl through, but there's always a way to get to where you want to be. Hardships often make ordinary people extraordinary. And I think that's true. You learn from every situation that you're dealt. So hardships are often the stepping stone to where you're going to end up. My family now has a big, huge joke that it took 2 knocks in the head for me to realize where God really wanted me to be. You know, things happen for a reason. At the time, you can ask anybody who was around me, I thought my life was over. But those hardships can make you extraordinary. Take it and run with it. And leave a legacy. You can have a legacy that's all your own. It doesn't have to be this big, huge mark that you leave. A legacy can be anything as simple as touching a child's life at the school that you volunteer at while you're in undergrad. It can be that cancer patient that you were there at their bedside when their family couldn't be. A legacy can be something simple that you don't even know the impact of until later on. Make sure that when you leave a place, you leave some part of you there. Make your mark. Just find that thing that you can leave to make everything that you embark upon better. And to end for you, remember that if you could only see how important you are to the lives of those you meet, how important you can be to the people you may never even dream of, there's something of yourself that you leave at every meeting with another person. And that's something that I've learned. People have touched my life and they don't even know it. So know that impact that you can have on every person that you meet. So thank you again for allowing me this amazing opportunity and this opportunity to visit with you all and to share a little bit of my story. And I will take questions.
Thank you, Jamie. We did have a question come through wondering how your experiences as a patient shaped the ways that you care for your own patients now.
That's a great question. I think that when you are a patient, you learn things that you want to do as a physician and not do. I knew what type of physician I wanted to be, not just from my experiences, but you know, if a doctor came into my room and handled me and my family a certain way, I could pick aspects of what I wanted to incorporate in my own practice. I think being a patient makes you realize more of what families are going through. So when someone shows up in your office and they're having a bad day and they're hollering at your staff, I've been there. There is so much more going on than what they're there in your office for. And what they show up for may not necessarily be what they tell you. And so you've got to understand the whole dynamic. And I think being a patient has helped me to incorporate those things that I want to be for those people. It may be that the medicine, the schooling that I had is not what they need. It may be they need someone who can just listen to them, listen to what they're going through. And I think being a patient makes you realize that.
Thank you, Jamie. We now have 2 short videos to share with you coming from our 2 recipients showing a day in the life of each. At the conclusion of these 2 videos, we will start with our next recipient's keynote. Enjoy the videos.
I would like to thank K-State, the K-State Alumni Association, and Student Alumni Board for awarding me this prestigious honor. Go Cats!